Hi guys, I'm Dr. Andrew Iraniha. Today I want to talk to you about the recovery of tummy tuck. A lot of patients of mine, they're extremely concerned about how much pain they will expect after this type of operation and essentially what is the recovery look like. So I want to go over that briefly for you today. Tummy tuck or abdominoplasty is a cosmetic operation that we performed to improve the body contour, essentially in people who have excess skin and also abdominal wall laxity or muscle looseness or diastasis recti, or even associated with hernia. They usually present and they are candidate for abdominoplasty or tummy tuck. So in this operation, we make the incision in the lower abdomen and then we separate the skin off of the muscle completely all the way to the rib cage, and then tighten the abdominal wall by tucking the muscle over each other with absorbable suture, and then we place a drain between the skin that is separated from the muscle, and then we close the skin in the lower part, and during that process we also reconstruct the new umbilicus or belly button. This operation takes around 2 to 2.5 hours, obviously depend on the size of the patient, and also if we add liposuction to it, it might take a little longer time. It's an outpatient surgery, and the patient comes in the morning, gets the operation and recover for a few hours after the surgery in the recovery room, and goes home. So when we perform this operation, because we tuck the abdominal wall and tighten the abdominal wall, people develop significant discomfort on the abdomen, including muscle spasm and pain. So the first few days is always very tough. We give the patients narcotics and also tell them to alternate that with anti-inflammatory like Motrin or Advil, and essentially they need to rest, but they have to get up and move around. We give the patient sequential stocking, which helps to circulate the blood into their legs, but also we encourage them to do deep breathing and moving around and basically ambulating. Majority of times the pain is associated with the changing the position, getting out of bed or laying down on the bed. But when you're stand on the feet, essentially the pain is tolerable. After a few days, the pain goes down probably maybe 20-30% in the first few days. And then when the patient has bowel activity and able to eat, the pain gets a little bit better. And normally a lot of patients, they take pain medications for a week after the operation. The drain is there to remove the excess fluid and or bloodish fluid in that space that we created between the skin and abdominal wall. And then normally I remove that after 1 week in the office, which is a very simple procedure. And then majority of patients after 1 week, they don't require as much pain medication, maybe take some Advil, but by 2 weeks, essentially people don't have significant pain. Essentially it's just going to be a little bit of soreness on the abdomen, but very tolerable. A lot of patients, they don't take any pain medicine during that process. They would have a abdominal widener, which basically a corset with a Velcro that they put on tight in order to decrease the swelling and allow the tissue to heal, and especially the skin that is separated from the muscle to stick to the muscle and heal. And normally I recommend abdominal binder for 6 weeks after the surgery. They cannot do heavy exercise or activity for 6 weeks, but we encourage them to move and walk, and they can even walk without any limitation as much as they can tolerate. So that's a general type of recovery for abdominoplasty. And even though the first a few days and maybe 1 to 2 weeks is a little tough, but essentially it's a incredible reward after going through this recovery, as far as tightening the abdominal wall muscle and also giving the patients a lifetime transformation and improve their contours. So if you have any question in regards to tummy tuck or called abdominoplasty, please call my office at 949-646-8444. Thank you.